The less omentum runs between stomach and liver, two layers of peritoneum that extend between the liver and the lesser curvature of stomach. Lesser omentum forms the anterior wall of the lesser sac. Lesser omentum attack the first part of the duodenum. Lesser omentum inferior margin first part of the duodenum. Lesser omentum contains portal vein and common bile duct in its free margin. Between two layers of the peritoneum at right free margin, it contains portal vein and anterior to it the common bile duct and hepatic artery. Transverse mesocolon is the anterior relation of the second part of the duodenum. Hilum of the right kidney is the posterior relation of the second part of duodenum, curves downward over the hilum of the right kidney. Portal vein posterior relation of the first part of the duodenum. Gastroduodenal artery is the posterior relation of the first part of the duodenum. Right renal vein is the posterior relation of the second part of the duodenum. Gallbladder. Fundus lie at the level of ninth right costal cartilage. Fundus touch the parietal peritoneum of the anterior abdominal wall at the tip of the ninth costal cartilage. Gallbladder usually receives blood from a branch of the right hepatic artery. Cystic artery is a usually branch of right hepatic artery. Gallbladder, only the bile duct contains between two peritoneal layers of the less omentum, no gallbladder. Gallbladder stores and concentrates the bile secreted by the liver. Portocaval anastomosis can be seen in esophageal branch of less gastric and esophageal branch of esophagus. Middle part of the esophagus drain into the esophagus system of veins. Lower part drains by the esophageal tributaries of the left gastric vein into portal vein. Portocaval anastomosis can be seen in superior rectal and inferior rectal vein. Upper part of the anal canal drains their superior rectal and inferior mesenteric veins into the portal system. Lower end drains to the inferior iliac vein through the middle and inferior rectal veins. Portocaval anastomosis can be seen in paraumbilical veins, superficial epigastric vessels. Portocaval anastomosis can be seen in colic vein and retroperitoneal vein. Anastomosis between portal and systemic venous drainage where ascending and descending colons are in contact with posterior abdominal wall. The pancreas, the main artery, splenic artery, and it supplies the neck, body, and tail. Head of the pancreas is supplied by inferior pancreatic or duodenal artery, and it is a branch of superior mesenteric artery. Head of the pancreas overlies the inferior vena cava at L2 vertebral level. At L2 vertebral level, head of the pancreas overlies the inferior vena cava and right and left renal vein. 5 to 50% of individuals do not connect the accessory pancreatic ducts. Accessory pancreatic duct passes from the lower part of the head in front of the main duct, communicates with it, and then opens into the minor duodenal papilla. About 2 cm proximal to the major duodenal papilla, occasionally it is absent. The appendix arises from posterior medial surface of the cecum, open into the posterior medial wall of the cecum 2 cm below the ileocecal valve. The appendix lie lateral to the ureter. The appendix is the three tenia of the cecum merge into complete longitudinal muscle layer for the appendix. The appendix lies on the right grundal vessels. The mesentery of the appendix, containing the appendicular branch of ileocolic artery, descends behind the ileum as a triangular fold. The rectum, upward lymphatic drainage is via nodes along the inferior mesenteric artery to pre-aortic nodes. Lower rectum to the internal iliac nodes along the middle and inferior rectal arteries. The rectum is drained by inferior mesenteric vein. The rectum has a peritoneum. Peritoneum covers the upper third of the rectum at the first front and sides. Middle third only at front, and the lower third is below the level of the peritoneum. The rectum drains by mesenteric lymph nodes. The upper drainage of the rectum is via nodes along the inferior mesenteric artery to pre-aortic nodes. The rectum is supplied by middle rectal artery. Rectum is principally supplied by superior rectal artery with contribution from the middle and inferior rectal and medial sacral arteries. Compared with lower end of ileum, upper end of jejunum, thicker wall. Jejunum is wider broad and thicker wall than ileum. Less fat in the mesenteric border compared to lower end of ileum, upper end jejunum. More aggregated lymphoid follicles are in the lower ileum, antemesenteric border. More arterial arcades are present in the ileum. Inguinal region forms by internal oblique aponeurosis. conjoined aponeurosis of the internal oblique and transverse abdominis arch over from the front of the cord laterally to behind the cord medial to make part of the roof and the posterior wall of inguinal canal. Inguinal region. Inguinal ligament runs anterior between anterior superior iliac spine. Lingual region contains two major nerves, iliac nerve, anterior ramus of L1, and the genital branch of genitofemoral nerve, union of branches from L1 and L2 within spermatic cord. Inguinal region, inferior epigastric artery runs medial to deep inguinal ring. Inguinal region, a direct inguinal hernia arises medial to deep inguinal ring. A hernia sac passing lateral to the artery through the deep ring is an indirect hernia. One passing medial to artery inferior epigastric artery through the inguinal triangle is direct hernia. The ureter runs on the right psoas muscle. The ureter passes down on the psoas major under cover of the peritoneum and crosses in front of the genitofemoral nerve. The ureter is narrow at the point it crosses the pelvic brim, pelviureteric junction where it crosses the pelvic brim. As it passes through the bladder wall, the narrowest, the ureter has an oblique course in the bladder wall. The ureter has a muscularis coat arranged in three layers. The muscle often appears histologically to be arranged as middle circular layer with the ureter is lined by transitional epithelium. The ureter blood supply of the ureter, upper part uretery branch of renal artery, middle part branches of abdominal aorta, lower part branches of inferior and superior vesical and ureteric arteries. The ureter is narrow at the point it crosses the pelvic brim. Ureter has an oblique course in the bladder wall. Ureter has a muscularis coat arranged in three layers. Ureter is lined by transitional epithelium. Regarding the intravenous urogram, in an intravenous urogram, intravenous pyelogram exam, and iodine-containing contrast material is injected through a vein in the arm. Ureter is seen along the tip of the transverse process of lumbar vertebra L3 to L5, L2 to L5. Anatomy of the minor calyces can be seen in regarding the intravenous urogram. Calculi in the bladder can be seen. Diagnosis of intravenous urogram includes chronic pyelonephritis, which may include the complications such as kidney failure, pus around the kidney, or sepsis. Regarding the mesentery, hepatoduodenal ligament contains proper hepatic artery. Lesser omentum has a right free margin where the anterior and posterior layers of the peritoneum become continuous. Within these two layers, it contains portal vein posteriorly, hepatic artery, and bile duct anteriorly. The appendix has its own short mesentery. The mesoappendix, which is a triangular fold of the peritoneum, from the left layer of the mesentery of the terminal ileum. Apex of the sigmoid mesocolon is anterior to the left ureter. On the left, the pelvic ureter underlies the sigmoid mesocolon. Hepatorenal recess is the inferior-most part of the peritoneal cavity, the supine position. Blind supine hepatorenal pouch is the lowest part of the peritoneal cavity. Which of the following structures are correctly measured with their location? Renal gland, duodenum, mucus secreting glands in the submucosa, jejunum, valves of Kerkring, PK circularis, numerous in the jejunum and proximal ileum, ileum pair patches. Granular penicills are at the bases of the crypts of the libercune of small intestine. They secrete lysozyme. Columns of Mogagni are found in the anal canal, longitudinal musical fold. Regarding the renal corpuscle, afferent arteriole and distal conjunctivule to form the juxtaglomerular apparatus. Macular densa is formed by distal conjunctivule. 25% corpuscles are all corpus are found in the cortex. The left ureter, the wall of the ureter contains two layers of smooth muscle arranged as in an elongated spiral known as longitudinal outer circular layer. Another outermost longitudinal layer present in lower third of the ureter. However, in really the three layers are often difficult to distinguish from each other. Ureter is a tube of smooth muscle lined internally by mucous membrane. The left ureter has an outer longitudinal muscle layer which continues with the muscle layer of the bladder. The left ureter beneath the epithelium is a broad collagenous lamina propria. Regarding the lesser sac, its anterior wall is formed by the posterior wall of the stomach. The posterior wall is formed by the anterior of the two posterior layers of the greater omentum. Bile duct is anteriorly related to epiploic foramen. Gastrostomach feeding tube G-tube insertion is done in part using a procedure called endoscopy. Lesser sac facilitates the movements of stomach. Regarding the portal venous system, portal vein is formed behind the neck of the pancreas. Portal venous system contributes about 75% of the blood supply to the liver. Regarding the portal venous system, communicate with systemic veins to bare area of the liver. Descending column is drained by inferior mesenteric vein. Left suprarenal vein drains to the left renal vein. Right suprarenal drains related to the inferior vena cava. Regarding the muscle of anterior abdominal wall, posterior rectus is incised in the subumbilical paramedian incision above a point midway between the umbilicus and the pubic symphysis. After incising the anterior wall of the rectus sheath, the rectus muscle retracted laterally so that the posterior wall of the rectus sheath can be incised. Lower four slips interdigitate with the costal fibers of the latissimus dorsi and the upper four fifth with digitation of the serratus anterior. External oblique arises by 8 digitations, one from the each of the lower 8 ribs just lateral to the anterior extremities. Internal oblique muscles arises from the wall length of the lumbar fascia, from the intermediate area of the anterior two-thirds of the iliac crest and from the lateral two-thirds of the inguinal ligament. Transverse abdominis originate from the inner surface of the lower six costal cartilage. Transverse abdominis arises from the lateral third of the inguinal ligament, anterior two-thirds of the inner lip of the iliac crest, the lumbar fascia, the 12th rib, and from the inner aspect of the lower six costal cartilage. Rectus abdominis arises from two heads, medial one from in front of the pubic symphysis and the lateral one from the upper border of the pubic crest. Regarding the superficial fascia of the anterior abdominal wall, fascia campa is well defined throughout the anterior abdominal wall. Fatty layer of superficial fascia is the fascia of campa. Fascia scarpa is continuous collis fascia. The fascia scarpa is continued over the penis and scrotum as the superficial fascia of the penis and the superficial perineal fascia. Penis within brackets box. Perineal fascia within brackets collis. The deep fascia of the penis is attached to the front surface of the pubic symphysis by the suspensor ligament of the penis. Beneath the skin of penis is the membranous layer of the superficial fascia called box fascia, a cylindrical prolongation of collis fascia. The membranous layer attached to the Holden's line. Below over the thigh, it's attached to the fascia lata along the flexure increase of the hip. Celiac trunk. Splenic artery is one of the three main branches of the celiac trunk. Celiac trunk has branches which supply the gallbladder. Celiac trunk, hepatic artery, common proper hepatic artery. Cystic artery supplies the gallbladder indirectly. Supply the celiac artery, celiac trunk supply the esophagus. The left gastric artery supply the lower part of the esophagus. Celiac trunk supplied by inferior phrenic artery. Inferior mesenteric artery arises from the L3 vertebral level. Inferior mesenteric artery, ascending branch of the left colic artery and inferior mesenteric vein lies on the left psoas major muscle. Inferior mesenteric artery supplies the left colic celiac flexor. It supplies from 1/3 of the transverse column from splenic flexure, left colic flexor to upper third of the anal canal. Inferior mesenteric artery crosses the pelvic ring at the sacroiliac joint. Renal fascia is a dense layer of connective tissue. Renal fascia at the lateral renal border. The anterior and posterior layers of fascia fuse. Renal fascia medially, the renal fascia blends with the sheath of the aorta and inferior vena cava. Renal fascia vertical axis of the kidney diverges toward the lower pole. Regarding the hernias, indirect inguinal hernia, persistent processes vaginalis predisposing factor for indirect inguinal hernia. Oblique inguinal hernia is lateral to inferior epigastric vessels. Umbilical hernia occurs as a weakness in the linea alba. Direct inguinal hernia is due to weakness in the conjoint tendon. Regarding the posterior abdominal wall, sympathetic trunk lies in a groove between the psoas major and the vertebral bodies. Lumbar vessels pass posterior to the sympathetic trunk. Cisterna chyli is situated under cover of the right crus in front of the bodies of the L1 and L2 vertebra. Iliohypogastric pierces the internal oblique above the ASIS. It pierces the external oblique epineuritis about 2.5 cm above the superficial lingual Ilingual nerve runs parallel with the iliohypogastric at a lower level. Regarding the kidneys, capsules of the kidney continues throughout the hilum to become coincident with the calyces. Renal fascia encloses the kidney and suprarenal gland in a separate compartment. Suprarenal glands and kidneys lie within their own compartment of kidney. When perirenal fat is absorbed, kidney can descend kinking ureter. Perirenal fat retains the kidney in position. Nephrostasis may develop after severe loss of weight. Floating kidney. Horseshoe kidney can rarely ascend up to superior mesenteric artery. Pancreas is an anterelation of the left kidney without peritoneum. The diploid foramen is potential space which can be expansible. Lower boundary of the diploid foramen is the D1. D1 lies at L1 level, so diploid foramen is at about level of T11 and T12. Diploid foramen is related to the portal vein posteriorly. Epiploid foramen is posterior to the portal vein and anterior to inferior vena cava. Epiploid foramen is bounded by caudate process of the liver superiorly. Superiorly caudate process of liver. Epiploid foramen acts as a passage for internal hernia into lysis sac. Which of the following structure correctly match with their anatomical relation? D1 retroperitoneal half is posterior to the inferior surface of the right lobe of liver. Root of the mesenteric crosses the third part of duodenum. D3 curves forward from the right paravertebral gutter over the slope of the right psoas muscle, gondal vessel and intervening ureter. Blood supply of the renal artery include suprarenal gland. Each renal artery gives off small suprarenal and uretery branches. Blood supply of the renal artery include ureter, perinephric tissues, renal capsule. Abdominal aorta as T12 level, right and left renal arteries arise at L2 level. Abdominal aorta lies left to the middle as it enters the abdomen. Abdominal aorta passes downwards behind the peritoneum on the bodies of the lumbar vertebra, inclining slightly to the left. Inferior phrenic artery is the first branch of the abdominal aorta. Abdominal aorta gives the accessory renal artery. One or two accessory renal artery arises frequently from the aorta above or below the main artery. Jejunum is wider bow and thicker wall than ileum. Jejunum is wider bow than ileum. The ileum lies mainly in the umbilical region. Ileum related to umbilical and hypogastric origin. Ileum contain mesentery that have more numerous arterial arcades than mesentery of jejunum. Ileum contain Merkel's diverticulum appears 2% of the population. Merkel diverticulum is 60 cm 2 feet from cecum and 5 cm 2 inch. Lesser sac can be reached by dividing gastrosplenic ligament. Lesser sac communicate with greater sac via epiploic foramen of Winslow. Lesser sac stomach is related anteriorly. The anterior wall of the lesser sac is formed by the peritoneum of the posterior aspect of the stomach. Lesser sac contains a posterior wall which covers the celiac plexus, celiac artery plexus and nodes. Left border of the lesser sac is formed by the suprarenal gland and gastrosplenic ligament. Regarding the lymphatic of GIT, lymphatic vessels of the stomach contain valves. Lymph vessels anastomose freely in the stomach wall, but there are valves in the vessels that direct lymph in such a way that the line between parallel to the greater curvature and the 2/3 of the way down the anterior surface indicate water shed. Bare patches visible through the lower reach of the ileum on the antimesenteric border. Regarding the lymphatic of GIT, lymph follicles numerous in stomach can become increasingly so along the Small intestine MALD. Periodic lymph nodes all together form origin from main vessels. Periodic lymph nodes at the origin of the celiac artery, superior and inferior mesenteric artery. Celiac group of nodes itself drained into by 2 or 3 lymph channel into the cisterna chyli. The body of the pancreas lies horizontal in the transpyloric plane. Neck of the pancreas. The body of pancreas has a triangular cross section. Um, the body of the pancreas has inferior border which splenic vein behind the body of the pancreas. The body of the pancreas forms the stomach bed. The body of the pancreas perfused mainly by splenic artery. The right ureter is closely related to the transverse process of L2 to L5. The right ureter is crossed by right colic artery. It descends lateral to the inferior vena cava and is crossed anteriorly by the right colic and ileocolic vessels. The right ureter enters the pelvic over right sacroiliac joint. The right ureter is nerved as vesicoureteral junction nervous. The right ureter is mesodermal origin. Which of the following structures are involved in innervation of the ureter? Ureteric plexus. Ureter is supplied from the lower three thoracic, first lumbar, second to fourth sacral ligaments of the spinal cord by branches from the renal and aortic plexus and the superior and inferior hypogastric plexus. The structure following involved with innervation of the ureter, aortic plexus, inferior hypogastric plexus, third sacral ligaments of the spinal cord, sympathetic fibers from T10 to L1 segment of the cord reach the ureter via the celiac and hypogastric plexus. Regarding the posterior abdominal wall, sympathetic trunk, it runs down behind the peritoneum on the vertebral bodies along the medial margin of the psoas muscle. Lumbar vessels passes posterior to the sympathetic trunk. Cisterna chyli is seen between the left crus and aorta. It is sympathetic trunk run down behind the peritoneum on the vertebral bodies along the medial margin of the psoas muscle. Lumbar vessels pass posterior to the sympathetic trunk, as elsewhere lies in front of the segmented vessels, the lumbar arteries and veins, but some lumbar veins may pass in front of the trunk. The cisterna chyli is situated under cover of the right crus in front of the bodies of L1 and L2 between the aorta and esophagus vein. Regarding the posterior abdominal wall, the subcostal nerve passes from the thorax behind the lateral arcuate ligament where it lies or below the vein and artery. Regarding the anterior abdominal wall, superficial fascia contains a superficial membranous layer, fascia of Scarpa. Superficial inguinal ring lies supermedial to pubic tubercle. Superficial inguinal ring lies above and medial to the pubic tubercle. Genital branch of genitofemoral nerve and autonomic nerve passes through the ring. Regarding the anterior abdominal wall, aponeurosis of the three anterior wall muscles fuse with each other at linea alba. Between the two recti, all the aponeurosis that form the rectus sheath fuse to form the linea alba, a strong midline fibrous structure which is firmly attached to the sigmoid process above and the pubic symphysis below. Portal vein is behind the neck of the pancreas. Left renal artery is inferior to the portal vein. Its origin lies in the transpyloric plane between the lower border of the body of the first lumbar vertebra and the upper border of the body of the second lumbar vertebra. Portal vein anastomoses with the branches of hemiasagus vein. Tributaries of the right branch of portal vein overlying the bare area of liver, systemic vein, retroperitoneal veins drain into the esophagus, hemiasagus, lumbar, intercostal and phrenic vein. Epiploidy separated from inferior vena cava. Portal vein. Portal vein is typically valvulus, so portal hypertension. Liver primordium is an outgrowth of the endodermal epithelium of the distal end of the foregut. Liver, a portal tract of hepatic lobules, small branches of the hepatic artery, portal vein and bile ductules. Liver is attached to the inferior surface of the diaphragm by coronary ligament. Liver goes up to the fifth rib during deep expiration. On the left, it reaches the fifth intercostal place and on the right to the fifth rib. Liver doesn't contain nerve fibers that sense pain. There are pain fibers, however, in the liver's capsule. The pancreas, the tail of the pancreas lie within the two layers of the sphenorenal ligament. This pancreas had its neck Entry at the commencement of the portal vein. Commencement of the portal vein is posterior to the neck of the pancreas. The pancreas cross the transpyloric plane in L1 level. The head and tail incline towards the prevertebral gutter, while the neck and body are curved broadly forward over the IVC and the aorta in front of the first lumbar vertebra. The common bile duct drain the gallbladder. Common bile duct and hepatic artery are situated anterior to the portal vein in the lesser omentum. The common bile duct is about 4 inches in adults. The bile duct is about 6 to 8 cm long and its normal diameter doesn't exceed 8 mm. Common bile duct is posterior elevation of the head of the pancreas. The posterior surface of the head of the pancreas is deeply indented and sometimes tunneled by the terminal part of the bile duct. The inguinal canal contains round ligament. In female, it contains the round ligament of the ureter. The inguinal canal wall anteriorly by external oblique aponeurosis, assisted laterally by the internal oblique muscle. Inguinal canal is midpoint of inguinal ligament. Regarding the blood supply to the gastrointestinal tract, common hepatic artery runs on free edge of the lesser omentum. Regarding the blood supply to the gastrointestinal tract, in the superior mesenteric artery runs anterior to the third part of the duodenum. Inferior mesenteric artery is medial to the left ureter. Portal venous system. No valves are present in the portal vein or vestibulotis. Semilunar line is lateral part of the rectus abdominis, stretched from the pubic tubercle to the tip of the ninth costal cartilage. The transverse abdominis forms the lector sheath below the arcuate ligament. Below the umbilical level of the transverse abdominis help to form the anterior rectus sheath. Above that level it forms the posterior rectus sheath. Superior and inferior epigastric arteries anastomosis within the rectus abdominis. Paraumbilical vein drains into the portal vein via ligamentum teres. Posterior intercostal arteries supplied by the superior intercostal artery, which is a branch of the posterior trunk of the second part of the subclavian artery. Regarding the inguinal canal, is more oblique in adult than newborn. Inguinal canal flow is made by the inguinal ligament and it is being reinforced by lacunar ligament medially. Inguinal canal is supplied by lingual it enters into the lingual canal by piercing the lower border of the internal oblique, not through the deep ring. Inguinal canal anterior wall is weaker than posterior wall in its medial half. Posterior wall is reinforced by medial by conjoined tendon. Regarding lesser sac, it's open and anterior to the inferior vena cava through the left peffermen. Regarding lesser sac, communicates with the Morrison pouch. Lesser sac is posteriorly anterior of the greater omentum, anterior surface of the transverse colon and transverse mesocolon. Peritoneum that covers the front of the neck and body of the pancreas. Upper part of the left kidney and left suprarenal gland. Regarding lesser sac can be entered surgically through the transverse mesocolon. Regarding the stomach, from the upper insert teeth, 7th inch commencement, 17 cm, 28 cm crossed by the left bronchus, 43 cm termination. Pyloric sphincter is anterior related to the pre-pyloric vein of Mayo, junction between the pylorus and the duodenum. Left lobe is the anterior relation to the fundus of the stomach. Anterior part of the stomach make direct contact with the anterior abdominal wall. Stomach bleeding due to erosion of the right and left gastric arteries. Regarding esophagus, it's compressed by a large tumor in the left bronchus. Its contraction point of the esophagus. Vagus carry pain from esophagus. Regarding the esophagus, lymph from abdominal part of esophagus drain to the celiac nodes into left gastric and celiac nodes.